My colleagues have just given you a broad definition of and outlined the extensive research of the EU Africa Personalized Medicine Consortium. And today I want to just present to you some sort of macro challenges and opportunities that we see for personalized medicine in Africa. And I want to entice your thinking and encourage you to think more about these aspects that I highlight. I mean, today the practice of medicine is changing. The advent of technology advancement in omics research has shifted the paradigm of modern medicine. 21st century technology gives us the means to enable precise healthcare. We're seeing healthcare systems evolve across the first world to create a patient-centric approach. Now, as Africa, we need to move a step further to address our disease burden more sustainably. One of the greatest lessons learned by the African continent during this current COVID-19 pandemic is most certainly the need and the urgency to invest in our healthcare systems. Now, the African health context varies. I mean, we are a continent with 54 countries. We have the second most populous continent on the globe, and we have a population of about 1.2 billion people. But more so, I mean, this is where the origin of mankind started. This is what the continent is known for, to be the cradle of humankind. But Africa, unfortunately, has a high underlying burden of disease, and it is the largest in the world. It has an enormous infectious disease burden, which plays a particularly severe role on this continent, and a burgeoning non-communicable disease burden that is highly underreported. Now, this has resulted annually, according to the World Bank and World Health Organization, to about over 800 billion US dollars in productivity loss. And unfortunately, our reality, in order for us to drive a real personalized medicine agenda, is we need to catch up. I mean, large-scale population studies have been performed on mainly Caucasian and Asian populations over the years, and this is mainly due to the technology mainly being developed there. And although Africa is the origin of humankind, and therefore, obviously, it has a large genetic diversity, and we have a population genetic diversity and population profiles that vary from north to south and east to west. Therefore, for Africa to move toward data-driven healthcare, there needs to be more research conducted on the African genome. This may be applied, to treat infectious diseases as well as non-communicable diseases, such as cancer and immune diseases, which utilize personalized medicine strategies to effectively treat people. And some infectious diseases, are being treated with these strategies, and they're beginning to adopt more precise diagnostic methodologies toward personalized treatment, such as antiretroviral treatment, patient management protocols. They're using more personalized approaches now. However, there are so many challenges. Now, in order for us to build a personalized medicine ecosystem, we need to drive an objective for this ecosystem, which would obviously be a better health outcome for every patient. And it needs to be driven by strong political will and administrative leadership. We need to, obviously, it has to have a rigorous foundation of ethics and legal frameworks put in place, and participation from the health systems community, health systems providers, doctors, hospitals, insurance companies that pay for treatment. We need core infrastructure, next generation sequencing technology to be present in all parts of the continent so that you can enable this, biobanks and data facilities, as well as, skills and training in genomics, bioinformatics, and clinical genetics. And what about access to efficacious and safe drugs, relevant drugs for our population? and being able to understand our population group. So we need more access to information and to the African population data. And we can at least then understand this and take genotypic information and phenotypic information and integrate this sort of data to create more targeted interventions. Now, this is quite a huge task, right? I mean, there are many challenges, and just to name a few, if you think of it from a leadership perspective, African governments, and I think all governments actually, but mainly here, we see that there's a trend. I mean, there are other immediate priorities that are usurping resources. And imagine what a task it is to ask them to now support high-end infrastructure, clinical services, as well as invest in like multidisciplinary healthcare teams to be involved in patient-centric diagnosis, large-scale population genomics research, and to get them to increase research funding pools. So we all have to advocate towards this, obviously. What about a balance between patient benefit and data sovereignty? We're seeing policy come up where there's now a more control over the way data is being managed, and especially patient-centric data. I mean, the continent is vast with a varying landscape and large diversity and economic status. And we've seen in the past that populations may be studied or people may be studied, and then that direct benefit to those groups are not actually seen, and therefore there's been this trend. So we need to find a balance. The continent is vastly urban and rural. Access to adequate healthcare systems vary on location. There may be weaker public healthcare facilities, but there may be efficient private healthcare facilities available. And how do we bridge the gap between, public versus private healthcare? There needs to be core infrastructure in place, such as, right now we have very few accredited biobanks. Genomic sequencing is not something that's human genomic sequencing is not something that is available in every country, as well as clinical genetic testing services. So the challenges go on. I mean, there's poor data infrastructure, lack of high performance computing in some areas. Digitizing health records seem to be a major issue in public sector facilities, and it's difficult to capture long-term phenotypic data. There is most definitely a gap of a lack of pertinent skills, especially in bioinformatics, big data scientists, genetics, clinical geneticists. Their skills are lacking. There are very few training programs available, especially in clinical genetics. Just as an example, and I'm not saying the others are not important. And there is very little genomic data on the African populations, like I mentioned before. But what does that mean? That actually means that currently we are deriving inaccurate genetic imputations of some genetic variants, especially when we try to correlate gene to phenotype and gene to environment effects. And this leads to, what about access to safe and efficacious drugs in Africa? And this varies. I mean, just normal drugs varies. You find that middle-income countries may supply essential drugs and vaccines with limited access to high-end biologics or targeted therapeutic interventions, and these still prove difficult for them to utilize within those contexts, especially disseminating at a public healthcare level. And then you have low-income countries, and these countries actually, they rely on donor organizations for supply of essential medication and vaccines with little or no access to high-end targeted therapeutic interventions. And consequently, I mean, these do not prove feasible markets for pharmaceutical companies, to provide these tailored therapeutics. And the populations in Africa are highly understudied. So also the medicines that are, especially these targeted-based medicines, are not really made for our populations in mind, for these populations that are in mind. But nevertheless, I mean, where there are challenges, there always has to be opportunity. I mean, opportunity buds within every challenge. That's my motto, and I think so. So if you look at, for example, how do we tackle this? This is a huge ecosystem to develop within any country within the continent. How do we tackle it? Personalized medicine, we know, has been demonstrated to be more feasible, especially in terms of long-term approach. to enabling a bench to bedside benefit. There is this agenda that the African continent is trying to pursue, which is called Agenda 2063, and a large component of the agenda is on healthcare. And obviously, you know, we can say that the COVID-19 pandemic has set a pathway toward the feasibility in creating sustainable healthcare. So we could create multi-country studies, you know, just as an example, to sort of develop African reference studies, or African governments try to get them to leverage into developing more knowledge on the African genome. At least start there. What about, you know, there's an opportunity in terms of the lack of ethical and legal frameworks. We could actually adopt similar frameworks so that we can create a cohesion in terms of the way we work. And we can have the primary objective to promote knowledge generation through research and sharing of data towards building the knowledge on the African genome, and enhance our resources for guided ethical review processes aligned to maybe international best practice. What about private healthcare, which largely runs on electronic health records? I mean, as well as longitudinal trials that are actually running. These collect verified phenotypic data. They can be utilized for large-scale studies, especially genomic studies. What about, you know, we could foster intercontinental linkages within, you know, those countries that have laid down the omics infrastructure and have the capability, such as South Africa, Nigeria, Kenya, I think Ethiopia, just to name a few, and forgive me if I'm missing any. They could help build capacity and process samples for neighboring countries or resource-limited countries. Create a scaled sort of personalized medicine program or couple programs to enable this and result in sustained. This could result in sustained training programs that can run alongside them. And I mean, what about what about pharmaceutical companies? You know, we could garner support from pharmaceutical companies, leverage clinical studies to address African population dynamics for provision of relevant treatments. You know, there's a gap in pharmacogenomic research, for example, on the African continent. And we need to encourage this sort of research in partnership with big pharmaceutical companies. And we may ensure that this sort of partnership can result in relevant drugs and maybe future access. What about the creation of an African reference genome hinged on clinical trial networks, such as, you know, the EDCTP, this forum? They could leverage longitudinal cohorts they've been working with, and large-scale genomic studies can be built to generate knowledge. And this will help alleviate the main barrier of developing integration of knowledge of the African genome to targeted interventions. And this could also help us advocate for focused funding if there's this willingness within the community. So I've just given you a few things to ponder. And given the broad continental context that we have, I mean, I've literally just touched on the iceberg. So I would want you to please take the time to think about, you know, how does personalized medicine fit into the scope of infectious diseases, for example? How do we pursue developing a continental agenda for personalized medicine? Should we actually have a regional focus in terms of developing this agenda from a EU Africa Personalized Medicine Consortium perspective? Are clinical trial sites equipped to participate in developing prevention care, personalized medicine strategies? You know, should Africa be focusing on prevention, or should we be focusing on precise diagnostics or treatment? So I'm leaving you with these things to think about, and thank you very much for your time.